Okay, hey everybody, it's Ed Crowe. Thursday, we're going to get started. I am recording this webinar. A couple house clean items, as I usually do before we get started and get into the topics. I often get the question, do we record these? We certainly do. We record all the webinars we do, and we put them on YouTube. So that's at Crowe Medicare. You would Google that, and that'll take you to the YouTube channel. We have hundreds of webinars on there on various topics, from everything from marketing rules to how to use Sunfire to work in different types of leads, marketing strategies. We've covered every topic, I think. In the future, next couple weeks, I'm going to do a full run through of using Sunfire and how to record the scope and the enrollment on Sunfire. I'm going to get more specific and show you a run through. It's actually very easy to use. I usually talk about Sunfire and Connecture. But I'm going to probably focus more on Sunfire for this AEP because they have voice, scope, and enrollment, and Connecture does not. Anyway, if you have questions when we get into our topic today, please send them into the webinar. I will answer them or try to answer them at the end. Promise I'm not ignoring you. It's just hard for me to look at them and run the webinar at the same time. And like I said, these will be recorded. I apologize for the voice today. It's given me some struggles here. So, our topics. What we're going to talk about are Medicare marketing rules for AEP, this coming AEP. Talk about the 48-hour scope briefly. Focus a little more on communications versus marketing and the approval process. You'll see that it's going to be important that you can access approved materials on the carrier portals. Talk about Connecture and Sunfire a little more, as I just kind of did it before my slide. But and again, the webinars are on YouTube. This one will run about 25 minutes. Go to @Crowe Medicare, or you can just Google YouTube Crowe and Associates. A couple reminders. Utilize our monthly lead program. It's $500 a month. You might as well use it for those who have their Medicare contracts with us. Send us AEP marketing money requests for AEP marketing money. I'm going to do a webinar, probably not a live one. I'll just record it and throw it up on the process, what we are looking for that, kind of what the carriers want and what you need to send us to access money to help offset your marketing costs for AEP. We have money even outside of AEP, in fact, with a couple carriers. On this call, if there's anybody that wants to sell Humana or is selling Humana, reach out to me. We have marketing money for them. Remember, the first looks for the carriers are on the Pinnacle website. So they're on there, pfsinsurance.com. You can see the first looks. It's a really good way to help you plan for AEP. And then if you need data carrier, you can call us at 203-796-5403 or email Lisa at croweandassociates.com. Enough of that. Let's get into our topics. 48-hour scope of appointment. We've been getting a lot of calls on this, a lot of conversation about it. All of these rules are from the CMS Medicare Communication and Marketing Guide. Final rule for 2024. They made a fair amount of changes. To what extent they'll enforce them, none of us know. We're going to find out, but the way I look at it, my job is to make you aware of them. I do get people who say to me, well, are you saying I have to follow these rules? Well, I can't dictate that. I'm just going to make you aware of them. And that way, if you want to be compliant and have, be sure you're going to avoid any potential trouble, you can do so. So CMS went back to the old 48-hour scope rule. For those who are newer to the business, it used to be that way. They always said you had to have take a scope 48 hours prior to your marketing appointment, your sales appointment. They're going back to that. However, there are three notable exceptions to the rule. Initially, they said they'd have no exceptions at all, and then suddenly they had three. I guess they got pressured, perhaps, from different groups, organizations, to make some exceptions. So here they are. The exception to the 48-hour scope rule, meaning you can take a same-time scope at the same time you write the application, whether it be voice signature, face-to-face. It's a walk-in appointment, so if you're in an office setting and somebody walks in, or if you're in retail, or if you're at any location and the prospect walks in to see you, that waives the 48-hour rule. You can take a same-time scope then. Inbound phone calls, so if you're closing by phone and the person calls in to you, that waives the 48-hour scope rule. And then lastly, the end of an enrollment period, it waives it. You can take it the same time scope at the end of an enrollment period. There is some confusion over it. Like AEP, I believe, said it was 7 days. I have heard from many sources that say it's 4, meaning it's waived, within 7 days of the end of an enrollment period, or other places have said within 4 days. I don't know. When I get more clarification, I'll update on the next webinar. But I've been told 4. A lot of people have told me 4, but AEP said 7. So it's one of the two. We got a 50-50 shot. Good enough, right? Keep in mind, scope of appointment forms are now good for 1 year. In other words, they don't expire after 30 or 90 days. They're good for a year. So if you want, for example, for AEP preparation, you can get scopes ahead of time. I know a lot of people are going to do that. They're going to call and get the scope verbally ahead of time, and then you'll have the scope. It's good for a year. So you can invoke that strategy if you'd like. It's a good way, a good option to use the voice scope function on Sunfire or on the carrier portals that have them. So get that scope ahead of time and get it out of the way. That way the 48 hours requirement has been met and you're all set. So how does this, how do you apply the 48-hour scope rule? How would it work? Well, if you take an inbound call, if somebody calls into you, then you can take the scope and do the enrollment at the same time. What if you called them? Well, if you called them and you want to enroll them, the rule says, since you called them, that's a 48-hour waiting period. So the idea is you'd get the recorded scope, you would wait 48 hours and then enroll them. What most telesales agencies do is either with a third party or themselves, they will reach out and then they will have that person call back. So you could do that on Sunfire. Everybody's assigned a phone number on Sunfire. You could call the client, they could call you, that would be an inbound call. Is that defeating the spirit of the rule that's been put in place? Maybe. But that's what's being done, and that would be an inbound call at that point, and that would waive the 48-hour scope. How would this work face-to-face? Well, if you're in an office setting or at a retail location or at a sales seminar, those are walk-ins, all of those. So that would waive the requirement. You can do the scope and the app at the same time. If you're going to somebody's house to see them, you're supposed to have that scope 48 hours ahead of time. What I would tell you there is the idea would be you'd want to have called them or talked to them and gotten the scope ahead of time, but that is how the rule is written. Will people circumvent that rule by some obvious methods? I'm sure, but those are the rules. When you have an existing book, get a scope when you talk to them. So first of all, I'll talk about this in a minute. If you're not calling your existing book, you should. Retention is much higher when you call it, and we're in a retention business with Medicare. It's cheaper to keep a client than get a new one. Cheaper by a lot. So if you're making calls to your existing book, get a scope while you make that call. Then you got it. Then down the road, if you need to make a drug plan change for them or an Advantage plan change, you can do so. Remember, scopes are only applicable to Advantage and drug plans. And again, retail is a walk-in, so that is the same time scope. I do see there's some questions coming in, and don't worry, I will answer those at the end. And if questions come to mind, feel free to send them in now because sometimes people are racing at the end before I end the call to send the questions in, and I miss them sometimes. Okay, let's talk about marketing versus communication. This is really just different language, but the same thing. Sales versus educational. You could interchange those terms, really. So I took this right off, more or less, right off the rule. But if marketing versus communication, how do you determine which is which? It's really no different than sales versus education. If the advertisement is intended to draw beneficiaries' attention to an MA plan, or plans, or PDP, I should say, and includes or addresses content about the plan, so the premium, the cost sharing, benefits, carrier names, I should add to that, including those not mentioning a specific plan by name. So meaning if you're mentioning benefits specific to a plan, if you're talking about a specific plan, about a carrier, that is going to be considered marketing. This includes instances where such advertisements are made on the behalf of multiple MA organizations. So that's marketing. So if it's plan specific, carrier specific, it is going to be marketing. All right. So in other words, if you're creating your own marketing materials, what they are now saying is you need approval for those materials. If you're pulling materials off the carrier sites, and all the carriers are going to have a lot this year, a lot of pre-approved marketing materials on their sites, you can use those. They're already approved. You don't have to submit them. They're good to go. But if you're creating your own marketing materials, that's going to need to be approved. What's the process for approval? Well, the upline, you'd send that to your upline, and then the upline sends it to the carrier, and then the carrier has to send every specific piece to CMS to be approved. So is that going to get backlogged? How's that process going to go? I put question marks there, but I think we know the answer to that. So if you can use communications, which we'll talk about in a minute, that's educational, generic. If you can use a communication piece that does not need approval, or if you can use the carrier's pre-approved marketing pieces, if you create your own, it needs to be approved. And I'm a little worried about the timing and how long it's going to take with those carriers taking those materials and then sending it to CMS for approval. But that is the process for this coming year. So as I mentioned, the carriers will keep all approved marketing materials on their portals, so they'll make a whole bunch of pieces this year. If you don't know how to access their materials on the portals, like Jarvis with UHC, for example, is a little tricky. I would go in there and look around on the different carrier portals to see if you can find the marketing materials. If you struggle finding it, call us. Call your agent manager. Good excuse to talk to them a little bit. Relationships with them are incredibly important. But learn how to access that stuff. Now remember, communication materials, so if it's not marketing, it's educational or communication, they do not need approval. This comes up a lot with educational presentations. As you guys know, we do a ton, we have agents do a ton nationwide of T65 educational meetings. We do a lot of them. I mean, we get great attendance, that's why we do them. We get good numbers from them. So our educational presentations are considered communications. They're not specific. They don't have plan-specific benefits. So, for example, most of you are using T65 presentations, again, that are generic. They don't mention a carrier, they don't mention names or specific benefits, so you don't need approval. You can go ahead and use it. A sticky subject with that, little debate here. In marketing versus communications, it's been specified by CMS that if a mailing piece, an advertisement, a presentation mentions specifically that MA plans have dental, vision, OTC, transportation, etc., extra benefits, and they mention them by name, like I just did there, that is considered marketing. And they suggest using the term instead extra benefits. So instead of spelling out what they are, you can just say extra benefits, and that's considered communication. But if you spell out dental, vision, OTC, transportation, that's considered marketing. So many of our generic educational presentations that our agents use spell those things out. So again, technically that then would be considered a marketing piece. What's interesting about all of this is some carriers already have approved T65 new to Medicare presentations available. They're updated and available, and they're approved as communication, as educational pieces, and they do list out those benefits. So, you know, to me, if there's already carriers with those presentations out there that list those things and they've got those approved as communications, that would be communications. I wish I could be more clear on that. It's hard for me to be, though. But I think at the end of the day, carriers are going to look at these rules differently, interpret them differently. So I don't think there's going to be a uniform opinion for that, something specific like that, if you can put that on an educational piece or not. The way that works, and what's also a little tricky, is, remember, we have to send any piece that you want approval on for marketing. We have to send to the carrier. But what if you're doing an educational piece and you just want to double check to see if that's, you know, works or not, if it's truly educational? It's educational. It doesn't spell out carrier names, so we just will rely on you to dictate to us what carrier you want us to send it to. Because, I mean, when you're doing educational, you're not pitching a specific carrier. But we just got to pick one to send it to. You don't have to send it to all of them. Because it's educational, you're not spelling out a carrier. But anyhow, Educational meetings, the rules haven't really changed. I mean, you can serve meals. The meal has to be less than $15. I guess they don't believe in inflation on the, on the educational meal side, because it has not been adjusted in years. You can give out cards, business cards, and permission to contact forms. You can get contact information. You cannot collect a scope at educational meetings. Most agents I see don't anyway, but you specifically in the rules cannot. The reason we always kind of promote and push educational meetings is because you can serve a meal, and ultimately the attendance is 4 or 5 times higher than when we do marketing sales meetings. That's why we kind of push them. I know they have drawbacks, but at the end of the day, you want to get as many people there as you can. Call recording is still a thing. I know that was a big topic last year, but yep, it's still around. Remember, you do not have to record calls if you're face-to-face. So just let's be really clear about it. Face-to-face, no recording. That's been confirmed, verified a million times. If you're face-to-face, you don't have to record. Connecture and Sunfire both have recording and they store it for you. So both those systems, if you're not using one of them, you should. They'll both record, they'll store the recording, they'll save it for you, and the systems are pretty simple for both. There's still a lot of agents out there using Medicare.gov. I would say it's time to change that. There's a lot of reasons why. I mean, on Medicare.gov, your client has to save their information. They've got to have a username and password. If you do it on Connecture or Sunfire, it's going to save the drug list, the doctor list. It's a CRM. It's going to save the client info. It's going to save the scope for you. It's going to save the enrollment information. And you can enroll the people off of there. So you can do everything you can do on Medicare.gov, but it's just so much more efficient because it's saving the information and you can make the changes and the enrollments you need to do through those systems. Carrier portals are fine for voice and online enrollment. The only reason I would say Connecture or Sunfire is better is because you don't have to log into all different portals to enroll with different carriers. They're all on there. The other feature that's nice, not used enough on either, is you can check on either system. In the top right on your profile, there'll be an RTS report on both, and that will show you all your carriers and your ready to sell status with them in every state. So we get a lot of calls where, and I don't blame you, it gets confusing, but an agent will say, like, what carriers do I have and what states am I set up in to sell them with? What states have I, gotten set up with to sell? Because they lose track of it. You can check that quickly in Connecture or Sunfire. It'll show you a grid. I would say Sunfire's is probably easier to use for that matter, but they're in both. Okay, and again, I'll answer questions once I get done here and I'm wrapping up. So, really important you reach out to existing clients prior to AEP. Your retention will be much higher. It's been proven. In Medicare, it's a recurring income business. So we get a lot of people that work really hard to just sell. They ignore their existing book. They get much higher amounts of people that fall off the books because of it. And it just really doesn't make sense. People always ask, what's the best method? Phone calls are the best method when reaching out to clients for AEP. Yeah, emails are fine. Texts are much better. Letters are great, but phone calls work the best. You can have someone make those calls for you if you want. You can develop a quick script, or if you have the ability to. You can develop a quick script for them. That's what I did for years. And then they can call the person. They can have that script you develop for them based on the plan they're in. Preset script that they talk to them with, speaking points. And as they're talking to them, if the people do want to shop their plan, they can update Connecture or Sunfire with their drug list, their doctor list, run the plans, and then set up a call with you, so it's way more efficient. When you get on the phone with them, everything's in there. It's ready to go for you, and you can just make the advice. You can have non-licensed people call and update drug lists, update doctor lists, and read them a generic script. You do not want them making plan suggestions or recommendations. You need to do that, or a licensed certified person needs to. Don't change people's plans just because you think they should. I get that a lot. A plan will change. Like I came out with a new zero premium plan in a lot of states where they only had the elite with $1,000 deductible. This new zero premium has no deductible. And I had a lot of agents saying, oh, now I got to move everybody. Let your client determine that. I mean, the less people you have to move internally in your book from one plan to another, the better. Moving people from one plan to another is completely revenue neutral for you. It doesn't make you any money. It's just spending time. Yes, you want to retain them, but you don't want to go flipping a whole book if you don't have to. It's not benefiting you. Be as efficient as you can with this process so you can work on writing new business. One last thing is when you talk to people during the year, if you can't sign them up for something, let's say they're on a plan they love or they're on the best plan, what they consider the best plan, book them for AEP. Don't forget about them. Say to them, yeah, look, you look like you're in good shape. Seems like you want to stay where you are. Plans are subject to change. Let's have a call during AEP. I know myself and I know a lot of agents that during the course of the year, they will pretty much book their AEP up with people like that. Consider member meetings if you have a large book. This has been done successfully. It's been proven. You can have a member meeting where you separate your book by product type, by company type rather, and you can have meetings for those members. Carriers will help, like say if you're doing a United member meeting, the carriers will help offset that cost. They want to retain their members. And what you can do is invite them to the meeting, pick a nice location, and have them invite a friend. And you can write new business that way. You can retain your existing book, encourage those people coming to invite a friend or bring a friend or family member, and get new business from that as well. But retention meetings have worked well, especially with people with large books of business. All right, just talk quickly about planning ahead of time for AEP. The first looks are out there, so start using them. In that way you can strategize as to what plans are changing in your area, or the areas you sell in, what looks good this coming year. You can start to make a strategy for what you're going to do for AEP. So look at the first looks. They're on the Pinnacle website, pfsinsurance.com, and the agent toolkit. Most of them are up there at this point, and you can see what's coming for 2024. Talk to your agent broker managers for the carriers. This is not utilized near enough. They have marketing money, they have ideas, and they can, more importantly, they can get you into retail locations. All of the carriers this year have various retail locations, including grocery stores, a lot of them. And it's the agent broker manager that can get you into those. It's best to stay on good terms with these people. What happens a lot is insurance companies do things that piss us off, make us mad. Maybe we get screwed over one way or another. And a tendency is to take it out on the agent manager. I would strongly suggest not doing that. You don't want to vent your anger towards them, because if you're pleasant to them, if you're going to work to sell their plan, then again, they can get you into retail. They have marketing money. They can help you out a lot. They have good ideas. So stay on a good basis with them. And if you're frustrated about something the insurance carrier did, first of all, I'd say I'd get used to it because they do it all the time. But second of all, I'd say try not to take it out on that agent manager. So as you're writing business in your AEP or any time of year, really focus on finding referral sources. I always tell people to do this. Not that many do it. The ones that do it benefit from it. Just as you're doing what you're doing, maybe you're even a phone agent, but find referral sources. Maybe that's an ACA agent. Maybe that's a P&C agency, auto and home. Find them. You can pay them a $100 referral fee for every advantage you close. So if you find a good one, talk to them about referring you business and pay them when you close the cases. And make sure you pay them. Don't make them chase you for it. I cringe a little saying this, but ACA, huge pain in the ass, like I said on there, but ACA can be a great way, a great lead source. And if you think about it, you get paid when you write ACA business. You'll get a lot of people in their early 60s that you'll be able to write. They'll have family members you can write for Medicare. ACA can be a wonderful lead source for Medicare, and it's one of the only lead sources that you get paid for. You're not paying the company, a lead company. You're getting paid. You're writing ACA business, and it will lead to a lot of Medicare referrals and sales down the road. Yes, there's drawbacks. The certs are annoying. It can be very frustrating on Health Sherpa or on the state-specific portals like Access Health. But for those who do it well, I think it makes sense. Not a lot, believe it or not, there's a bunch of ACA agents out there that don't write Medicare. They're a great one to partner up with and get referrals from. So if they're not writing Medicare, there's a great person who can refer you Medicare business because they've got people turning 65. That's it. It was a quick one. Let's see what I did time-wise. Yeah, about 25 minutes. So let me check and see if we have questions. Before I do that briefly, though, remember, AEP marketing money requests, we do get money from carriers. There are a couple carriers that don't give us any money where you've got to have a relationship with the agent manager to get it. But there are many that do, and you would want to send us a proposal, what you're going to write, what your lead carrier is, because that money we give out, they're going to want to see sales for that money, and they usually go about it. They want to see a sale for about every $125 of their money you get. I'm going to do a webinar, like I said, I'll post it. I'll just do it probably not even live. I'll just put it up on YouTube on the best method. It'll be really quick, 5 minutes, on how to put a request into us, a business case for marketing money. Reach out to us if you need help with developing a marketing plan and writing business. For those who don't feel confident with Sunfire or Connecture, from my office, we are going to do screen shares with agents where we can do run-throughs of how you would do, quote benefits, enroll people, do a voice scope, that kind of thing. For those who are within distance or want to make the trip, we have our AEP rollout meeting on September 8th at Mohegan Sun. We'll have all the carriers there, and they will have information for multiple states. It won't just be Connecticut specific. It'll be a great event. It's Pinnacle and Crowe agents. It's from 10 to 5. Would really like to see you there. We've been sending out links. It is something you need to register for. If you don't get your link, maybe it's going to spam or you didn't see it, just call us and we can send it to you. As I mentioned earlier, please feel free to join our weekly Zoom calls. We'd love to have you on there. We usually do those on Tuesdays. We send out a link for that as well. And I appreciate everybody attending. Let me see the questions. See what we got. Somebody said lots of office walk-ins this year. Yes, I think that's poking fun a little, given the fact that a walk-in is one of the reasons why you don't need a 48-hour scope and you can take a same-time scope. So yeah, Dan, I get you there. Okay, please clarify Sunfire telephone number specific to me as an agent. Yes, Sunfire assigns you a phone number. So you call out from your computer from that number, and when you talk to somebody, they can call you on that number. And if they call you, that would be an inbound call. No, they would not leave a message. When they call in, you got to be sitting at your computer and you take the call. I'm going to do a run through, and what's nice about Sunfire is it reads the disclaimer to them and tells them the call is recorded, so it keeps you compliant in that regard. And you can either say that to them verbally yourself, or you can just click a quick button and it'll be a voiceover that'll say it. And you can also talk at the same time. So that could be a little confusing. You probably don't want to talk then, but you could. Somebody gave me a really specific one. I might take this offline. I'll try to read it quick. My client received a termination letter from Medicaid. I submitted a Plan G app that was denied because the termination letter did not specify. Yeah, I think I'll take this one offline. Not really something I would hit on this seminar, I don't think. Just for the sake of others, kind of very specific. Okay, let's go to the next question. How could the 48-hour rule integrate with the recording requirement? For example, if you speak with a prospect, you called them off a BRC lead and request that they call you to discuss the plan and hopefully close. Let me read the rest of this. And hopefully close, would that require recording? If so, what parts? Well, the 48-hour rule is really just pertaining to the scope. It really has nothing to do with the recording other than the fact that you could record the scope on Sunfire. So again, to go over your scenario, if you speak with this prospect you called off a BRC lead and request that they call you to discuss the plan and hopefully close, would that require recording? Yes, if you're not meeting them, recording's easy. If you're not face-to-face, you need to record. End of story. If you're face-to-face, no recording is required, separate from the scope and 48-hour rule. So face-to-face, no recording. Closing over the phone, over Zoom, over any method not face-to-face, it's got to be recorded. Hopefully that answers your question. Do I expect the emblem first look soon? Yes, I do. Both emblem and Connecticut, I expect that first look next week. How do you get into the ACA business? Well, it's quite a venture, but basically separate contracts with a lot of carriers, a certification, like one uniform certification, very state-specific. But in some cases, it's an overlapping contract with Medicare. That's fine. So that way you're already set up. You just got to basically certify through the ACA. for example, a state like New York, they use the federal exchange. So you can do enrollments through Health Sherpa, but you'd have a lot of carriers in New York, that you might want in that case because there's a lot of small ones. New York doing ACA, but basically in that case, then it'd be separate contracting really for most of the small carriers you probably wouldn't have on the Medicare side, in a certification. Somebody said, "Hey, how do we set up a Sunfire training to learn the recording features? Just give us a call and we can run through it for you." Let's see. Enrollment calls only recorded. Prior calls not involving an enrollment at that time need to also be recorded. No, if it's communications, they're very pretty clear on this. Communications does not need to be recorded. If you're talking benefits, if you're enrolling, that needs to be recorded. Let's just be really straightforward about this. Usually, they're saying if it's marketing of any type, it needs to be recorded. However, what I can tell you is kind of across the industry, they record the enrollment call, meaning if it's an inbound call or outbound call, they're talking to the person, they're going over benefits, that kind of thing, they enroll them, that's the call that's recorded. And if you get a complaint or an allegation, that's what the carrier is going to ask you for, the enrollment call. Let's see. Is that all we have today? Good questions. Sorry, I'm losing my voice. Looks like, how do we sign up for the weekly Zoom meetings? We send that out as a link, so it goes out in an email. If you're not getting that email on the Zoom, like we did one this week, so that was emailed out. It's just a registration link, and we send it out. But would love to have you join the call. So if you don't get that link, just let us know. Speaking specific to this person who has the question, you are on that email. Maybe it's going to your spam, or maybe we need to send it to a different email address or something like that, but we can get it out to you. Okay, somebody said paper scopes in advance, mail out, and wait for the. Okay, let me click on the question. Paper scopes in advance, mail out, and wait for the return mail. Yeah, if you want to do paper in advance, that you would mail it out and wait for it to come back. If you need to follow the 48-hour rule, that's why I think you're going to see voice scopes, email, and text scopes through Connecture and Sunfire become pretty popular for that reason. But yeah, you can mail them out and you hope they come back. Let's see. It looks to me like that's all we have. Well, I appreciate everybody coming on. Thank you so much for attending. Hopefully it was helpful. And we'll have a Zoom call next Tuesday, and we'll definitely do a webinar. I think might do a webinar on a run-through of Sunfire. We'll see. And really thanks for coming on. I really appreciate it. Feel free to call if you have any questions. And I hope everybody has a great day. Thank you.